So here we have a more detailed overview of our algorithm. At the top, you see our primary questionnaires. The distress thermometer and the ESAS are given at every visit with the nominated clinician. And you'll see that taken with the social difficulty index and the Canadian problem checklist, we do screen for physical, emotional, practical, and social symptoms and concerns, so a very comprehensive screening. We have 5 symptoms on the ESAS that, depending on the score, can trigger secondary questionnaires. What sets Empac apart from many other pro screening programs, including those that are already available in the province, is that we hope that over time, the clinician report will be directly available in the electronic medical record for quick screening, scanning by the clinician, so they know right away what are some of the symptoms that need to be addressed. But more importantly, we're focusing really on increasing symptom management through greater patient engagement. So patients also receive a summary report in addition to the clinician. It's the same data, however, presented in a way that is accessible to patients. There is an alert system that is in place to really try to trigger future clinical response. And also the fact that we're not saying that every patient needs a follow-up, that the symptoms are really categorized in terms of their levels of severity based on well-documented clinical cutoff points. And we know from clinical practice guidelines that a certain level self-management is very effective. And so this is why we have a very comprehensive self-management library available on our website. So this is an example of our screening dashboard. So every clinic that is part of Empac receives this monthly screening dashboard. So at a glance, very, very easy for managers to see what are some of the key issues of patients in their clinics. So here we see for ESAS, it's a lot about tiredness, drowsiness, 11% of patients were very severe on the distress thermometer. And in terms of some of the other symptoms, you can also see that sleep was an issue. However, I do want to emphasize that depending on the level of severity that was declared by patients, almost 50% of them had no actions that were warranted at this point in time. So again, it goes to the previous slide where we talked about efficiency. So you know exactly which patients need the very scarce healthcare resources and time, as opposed to those that you'll continue monitoring, maybe that you send to self-management resources to help them cope with those mild symptoms. We did just conclude a pilot at one of our centers, and I'll just share with you what patients said. So we interviewed patients after they received screening. So generally, the patient experience was very positive, and what they particularly liked is that everything was centralized and easy to find. So one patient said, "I think the navigation is great. I think everything is at your fingertip, one click away, which is important. I think it's not overwhelming, the information too. It's just the homepage. I like the alerts, and I really think it's user-friendly." So at this pilot site, I have to add that we were screening using a mobile application that the center has adopted. Another key advantage is feeling supported for patients. So the program complemented and enhanced the care received at the clinic. And I think it complemented the care because Empac was co-developed with all of the centers, key representatives from each center. I think it helped me to know that even though I have quite a good support system, I'm not alone in this with the medical team. So Empac helped me connect with the medical team, knowing that they told me when my appointment was, I checked in the hospital, and you feel like you have someone with you along the way, even though it's virtual. In terms of the questionnaires, patients felt that it captured well their experience. These were relevant and easy to complete. And participants usually completed questionnaires when they felt more comfortable. So often this was at home, but some also completed it in the waiting room. So one patient said, "I was impressed. It was pretty quick. Like I mentioned, it looked overwhelming, but when I actually did it, it was pretty quick. And that's why I did it, because I think it has to be quick." And then it was very user-friendly in a sense, like the multiple choice and the quickness was just, going through a series of questions. In terms of the educational and self-management materials offered, bottom line, nothing will ever replace a conversation with the healthcare professionals, but the self-management materials were considered very useful and evidence-based. They were also comprehensive, easy to navigate, and clear. And even if a resource did not apply in a participant's specific case, they felt that it was good to have access to these resources in case they were needed in the future. And patients really felt reassured to know that others had similar experiences to them. So when asked about the self-management material, one participant said that it was a credible resource, and the worst thing that you can do sometimes is to Google something when it happens. Use of results by healthcare professionals. Initially, the feedback was mixed, but as healthcare professionals also used the reports in their consultations with the patients, the results were much more positive. It was very important for patients to know that healthcare professionals read the results and that follow-up actions were taken into consideration. Even when the results were all mild symptoms, patients did not expect a clinical action, but they did expect some acknowledgement that they've completed the results or the questionnaires. So here's the overview of Empac. So we continue to collaborate among many platforms, many other provincial initiatives. As I said, we're not a platform. We really take the platform that is available at the different cancer centers. What I presented is the main Empac algorithm, and we are working on different illness submodules. So we hope in the end to be able to really capitalize on the evidence base that I previously reviewed and really facilitate implementation of this evidence in everyday cancer care to ultimately offer more patient-centered care, but really so that our patients can really benefit from the improved symptom severity and quality of life that results from regular systematic pro screening. Thank you very much.